welcome to this channel. Today, let's talk about a very common, debilitating, serious, and potentially even life-threatening mental illness called depression. It is very important for us to understand a number of mental disorders, a number of psychiatric illnesses, but most importantly, depression is one that we should quite know a lot about for a number of reasons. One of them is that depression is a very common mental illness, and also because depression can potentially result in serious problems, including even making an individual to commit suicide in the severest forms of the illness. So, what is depression? Depression is actually a mental illness, as we said, and it can present with a number of symptoms. So it is important for us to know these symptoms just so that when we see depression in a loved one, in a friend, or even in ourselves, we can probably be able to say, wow, this is probably depression, and we can advise the person to see a mental health professional or to see a doctor generally. So the most important and the commonest symptom of depression is a depressed mood, also known as a feeling of sadness or a feeling of unhappiness. Depressed mood is the most important symptom. The person that has depression would begin to start feeling a persistent and sustained unhappiness, feeling of sadness. Persistent and sustained because in depression, unlike in normal feelings of sadness that people undergo or experience from time to time, in depressed mood, what happens is that the feeling is there virtually throughout the day, and the feeling is usually there almost every day. So that makes it a little bit different from the kind of sadness that you may find if maybe something makes me unhappy, and then after some time I see myself overcoming it. In depression, that feeling of sadness or that depressed mood tends to remain persistent. It should be there throughout the day, and it may be there virtually every day throughout the period that I'm having that depression. So the first symptom is that sustained feeling of sadness or that depressed mood. The second important symptom of depression is loss of interest or pleasure. In depression, there is the tendency for the person suffering from it to have a loss of interest and inability to enjoy activities that they previously enjoyed. So if this person was somebody who used to enjoy cooking, for instance, if she's a lady and she used to enjoy cooking, or she used to enjoy hanging out with friends, or if it's a guy that likes watching football or that likes hanging out with friends, the person will now realize that none of those activities give him any pleasure. So he will lose interest in them because they do not give him pleasure. So, and that results in the person engaging or kind of engaging less and less in those activities that previously gave them pleasure. That symptom accounts or explains why, for instance, you find a depressed person usually always staying by himself, especially if the depression is severe. Later in this video and in subsequent videos, we're going to talk about the gradings of depression. Not all depressions are severe. There are different types of depression in terms of the severity. It can be mild, it can be moderate, or it can be severe, depending upon the number of symptoms that are present and depending upon the impact of the illness on the person's ability to function in his normal day-to-day life and normal day-to-day activities. But suffice it to say that loss of interest and pleasure is usually found in people who have depression, and it is the second symptom. The third symptom that we're going to talk about is decreased energy and also reduced activity, or the person becomes easily tired. So generally, this symptom has to do with the energy level of the energy of the individual. In depression, people often find that any small thing makes them easily get tired. They easily become or they do not even have the energy to go about activities that they previously engaged in. Once they become depressed, they realize that they cannot be able to go about those activities. Come to think of it, generally, I'm sure if you look back and look at your life, you might notice that anytime you're happy, you tend to be overactive, you tend to be energetic, you tend to be up and about, you tend to feel a lot of energy. You find yourself being so full of life, being able to do virtually everything. And even general reduction in happiness or a feeling of sadness, which is normal, if you realize, it tends to make you not want to do anything. So by the same token, what happens in depression is that if you are sad, or patients with depression, they tend to realize that the depressed mood tends to make them not to have energy to do anything, or it makes them feel that doing anything comes with a lot of effort. For instance, for women, doing normal household activities or doing normal household chores tends to come with a lot of effort. They have to force themselves to do it. Or there is this realization in some patients that it is not that they don't have energy, but that they may have some small amount of energy, but that as soon as they do something, they easily get tired. After engaging in some of the most trivial activities, they find themselves without energy to carry on, without the energy to go on. So in essence, decreased energy and reduced activity is also a significant symptom of depression, and it is the third symptom of depression. The next symptom of depression we're going to talk about is difficulty concentrating. Patients, when they have depression, find that they are unable to bring their mind into one place to concentrate and complete a certain task. For instance, if they want to read a book, or they want to watch a movie, or they want to think through a certain idea to come to a conclusion, they realize that that becomes too much of an issue. They have difficulty doing those kind of things. What happens is that they find themselves being easily distracted. Any small thing takes their mind away from whatever it is that they are doing, and it takes a long period of time or a lot of effort to bring back their minds to what they were previously doing. So that is altered concentration or difficulty concentrating, and it is also a significant symptom of depression. The fifth symptom of depression we're going to talk about is feelings of worthlessness. Depressed persons usually find that they tend to look down on themselves. They tend to feel that they are useless. They tend to think that they are unimportant. They tend to think that they are worthless generally. They essentially look down on themselves. Let me also mention here that people who have depression tend to have a lot of negative thoughts, a lot of negative ideas about themselves. They tend to, for instance, think that they are useless, they are not going to amount to anything, their future is going to be hopeless, and what have you. So this is classically what is found in depression. So these ideas or this feeling of worthlessness is often accompanied, or it might give way to ideas of guilt, in which the person feels guilty for doing nothing, or feeling guilty for doing something very trivial in the past. Maybe the person may have done something very trivial. Maybe he may have stolen a pen from a friend in class when he was in primary 5. Now that he's depressed, the memory comes back to his mind, and he begins to feel that, wow, look at how terrible of a thief I am. So the person becomes very guilty. The person feels very worthless. In fact, it might become so severe that individuals with depression, if they have significant symptoms or ideations of worthlessness and guilt, they might even go and confess to an offense or a crime they may not have committed, and that becomes a very significant forensic psychiatric issue. There are times when you come across a patient who says that, wow, I am a terrible person, I don't have, I've been committing offenses, the police should come and take me and go and shoot me or something. So you come across these kind of things, and it's simply because of the feelings of worthlessness and the ideas of guilt. The sixth symptom of depression that we should understand is hopelessness. Hope. Generally, what keeps us alive, they say, is hope. Now, in depression, that hope tends to vanish into the thin air. They do not have hope. And hope has something to do with expecting something positive or good to happen to you in the future. Right? Now, in depression, that hope goes away. They find that they do not think that anything positive or anything good is going to come their way in their lives. They begin to think that their health is going to deteriorate, their finances are going to get so terrible, their families are going to leave them, so everything in their lives, they tend to think that it's going to go bad and worse in the future, and that is ideas of hopelessness. In depression, as we mentioned briefly earlier, some of the patients with depression tend to commit suicide, and that one indicator it was found is significant in predicting whether any patients with depression might commit suicide is these ideas of hopelessness. If patients score very highly on hopelessness, then there's every tendency that they might actually commit suicide, among other factors. This is not just one factor that is looked at or that is responsible, but that it might be a significant contributor. So hopelessness is that feeling that patients have when they have depression, in which they think that nothing good is going to come in their life. And it's part of that negative thinking that is seen to happen in all patients that have depression. And I want you to also look at your life. Anytime you begin to start feeling every thinking that comes to your mind is negative, okay, look at how terrible I am, look at how I'm failing exams, look at how I am failing in my finances, look at how terrible my business is going, my work, I'm not productive. So if you begin to see yourself being excessively self-critical, all the thoughts that come to your mind, if they are negative, then there's a possibility that you might have depression. And even if you don't have depression, you might be at risk of developing depression in the future. And so that's a very important symptom of depression. The next important symptom of depression, which is the seventh symptom of depression, is recurrent thoughts of death or suicide. Recurrent thoughts of death or suicide is a significant symptom of depression. What happens in some patients when they have depression is that they tend to think a lot about dying, a lot about death. I'm going to die. What if I die? When I die, what happens to my children? I might die. So not necessarily thinking that they should kill themselves, they should commit suicide, but that a lot of thoughts about death tend to come into their minds often. Other categories of patients tend to think that they should end it all. They should go to bed and not wake up, or they should even take a step towards committing suicide. So that recurrent thinking about death or recurrent thinking about wanting to commit suicide, this is also a significant symptom of depression. So if a family member tells you that nowadays I think a lot about death, or nowadays I think a lot about maybe I should even die, maybe I should even kill myself, that is a significant symptom, and it might point to the fact that the person might be depressed, and you would have to advise the person to see a doctor or other mental health professionals who would be able to help the person. The next symptom, or the eighth symptom, is that in depression there is change in sleep or change in appetite. Sleep is also a very important attribute of us humans. We all sleep, right? And averagely it is said that a normal adult should sleep between 6 to 8 hours, although there are shallow sleepers and there are heavy sleepers, but average 6 to 8 hours. In depression, what happens is that they tend to sleep very little. Despite sleeping very little, when they wake up, they also feel they are completely unrefreshed. Normally, when you wake up after sleeping in the morning, you feel kind of refreshed, you feel kind of rejuvenated, you feel re-energized, you feel kind of active. But in depression, they sleep little, and when they wake up, they feel completely unrefreshed. Classically, what happens in depression concerning sleep is that the person tends to have reduced sleep. So the quality of the sleep is reduced and the quantity of the sleep is reduced. Another thing that affects the sleep in a patient with depression also is that they find it difficult to sustain sleep. Initiating sleep, it might not be an issue, but sustaining sleep might actually be an issue. So sustaining sleep in the sense that when you fall asleep, you are expected to maybe continue sleeping, except maybe if you wake up in the middle of the night, maybe to go and empty your bowel or to go and urinate or something. Now, but in depression, patients find that they wake up several hours earlier than their normal waking periods, usually classically 2 to 3 hours earlier than their waking period. So if you are used to waking up 6 a.m. or 5:30 a.m. and you now find yourself waking by 2:30 a.m. for instance, or by 2 o'clock in the middle of the night, and you find it difficult to go back to sleep, then there is every tendency that perhaps you might be having a symptom of depression that affected your sleep. Now, classically, what happens again is that when they wake up in the middle of the night and they find it difficult to go back to sleep, additionally, they also have associated negative thinking. Remember, we mentioned that most of the thoughts that comes through the mind of a person with depression are usually negative thoughts. Negative thoughts about themselves, negative thoughts about the world, negative thoughts about the future. Negative thoughts about themselves include, I am a terrible person, I am useless, I am worthless, I'm a sinner, I deserve to die. Negative thinking about the world is that the world is terrible, it's probably going to come to an end, we should all die. Negative thinking about the future include nothing good is going to come my way in the future concerning my health, concerning my finances, and even my family. That's the hopelessness that we talked about. Now, in patients, when they wake up in the middle of the night and they have this associated negative thinking, and they have difficulty going back to sleep, then this is a very significant indicator that they are probably depressed. And the best thing for them to do is to see a mental health professional. The same thing affects their appetite. Usually, you tend to eat food, you look forward to eating food and what have you. In depression, eating food is no longer pleasurable. And even if they eat, it's not because the food, they are just probably eating because they want to remain alive, probably. So it's not because eating food. So eating food becomes as if they are forced to do it. Sometimes some patients with depression tend to lose weight and it might even become significant weight loss, in which they lose over 5 kilograms of their weight, partly because of this reduction in appetite. Of course, if you do not eat food, you're going to have to burn the energy that you have reserved in your body. Now, burning that reserves in your body to give you energy is going to result in weight loss. So that's one of the reasons that partly explains the weight loss that comes with depression. So by and large, these are the symptoms of depression. But in the hospital, in clinical setting, for us to diagnose depression, these symptoms have to last a certain period of time. These symptoms classically have to last for 2 weeks for it to be considered significant. And additionally, these symptoms have to result in significant disability. And by disability, I simply mean a significant functional impairment. And by functional impairment, I mean an inability of the person who is so affected by these symptoms to carry out his normal daily activities, in which the person will now have difficulty even taking care of themselves, or difficulty relating with people, including family, or difficulty going about their normal work or academic activities if they are students. Now, this or any important areas of functioning for that matter, depending upon the kind of life that that person leads. So if we find that the symptoms last 2 weeks or more, and they result in significant functional impairment, either personal functioning, occupational functioning, social functioning, and they also result in some level of distress, significant level of distress, then that perhaps warrants a diagnosis of depression. So the idea here is that any time you have any of these symptoms or a combination of these symptoms, it is very advised to see a mental health professional.